The call for Congress to pay more money to doctors treating Medicare patients.
Here to explain is Dr. Shadi Karoush, the Director of Community Health for the Dermatology Department at Mass General Hospital. Dr. Karoush, thank you so much for joining us this morning.
Thank you. Good to be with you.
We know this is a really important topic to you. You made the case this week in an article for U.S. News and World Report. How much do doctors get paid now?
Doctors are getting paid 30% less by Medicare than they were 20 years ago when we adjust for inflation. Meanwhile, the cost of operating a medical practice has increased by about 47%. So the issue is that when the reimbursements to doctors from Medicare fall below their costs of delivering services to patients, we have a math problem. The system becomes economically unsustainable, and doctors are having to stop seeing Medicare patients or close their practices entirely. Now, this is another problem because the population of people on Medicare is rapidly expanding, and we need doctors to take care of them.
It is a growing population. Actually, more than 25% of Americans are currently enrolled in Medicare. How do the low reimbursement rates affect patient care and the patient?
That's a great question, Rondella, and you're absolutely right. The population of people on Medicare is growing about 5 times the rate of the total population. So that's a lot of people that are going to need doctors who take Medicare. And so we cannot have people dropping out, both healthcare providers and clinics, dropping out of the Medicare system at a time that we need more doctors than ever to see Medicare patients. And we're already seeing that workforce shortage because in certain areas, people are waiting 3 and 4 months to see a doctor because they can't get in and there aren't enough doctors seeing Medicare patients. And the effects of this are really bad for patients because they're getting delays in care. For example, if someone has something that is a cancer that needs to be checked out, they shouldn't have to wait 3 to 4 months. And they shouldn't have to go to an ER because we know that we have an issue with ER overcrowding. So that's not sustainable for patients either.
It feels like such a complicated issue. In your opinion, what's the solution here?
Well, we need to fix Medicare. So just last month, the Centers for Medicare and Medicaid Services, CMS, announced another pay cut to providers taking Medicare, and that's for the 5th year in a row. And so Congress in the next few weeks may have the opportunity to vote to stop those Medicare cuts, which is going to be important to prevent the financial strain that's going to come on the system come January if those Medicare cuts are not stopped. So this is something that is bipartisan. There are members of Congress, both Republican and Democrat, who are actually doctors who understand the healthcare system that are working on legislation to fix this problem. So the article that I published in U.S. News, I co-authored with Congressman Bera and Congressman Bucshon, who are a Republican and Democrat member of Congress who are doctors, who are supporting and co-sponsoring legislation to permanently fix Medicare. So in the short term, we need to notify our members of Congress to stop the Medicare cuts. And in the longer term, we're going to need a permanent fix of Medicare reform.
Okay, if we're lucky, we all get to 65, and this is a situation to watch. Thank you for raising awareness, Dr. Shadi Karoush. We know you wear a lot of hats. You're also an associate professor at Harvard Medical and the Harvard School of Public Health. Have a good weekend.
Thank you.